Role of a community health nurse in the community. 1. Nurse clinician, care provider. The clinician role in community health appropriates the health services to individuals and families, to groups and populations, emphasis on holism, health promotion, and skill expansion. Nurse educator health teaching is a well-known component of community health nursing practice and basic weapon in preventing behavior-oriented communicable diseases and non-communicable diseases, facilitate clients' learning and create awareness on health matters, focuses on disease prevention and health promotion throughout nurse advocate. Community health nurses explain about the health care system, advice on diseases, provide referrals, and guide them for follow-up. This role sets certain criteria like being assertive, willing to take risks, communicating and negotiating, and identifying resources and obtaining results. Nurse manager exercises administrative direction towards the accomplishment of specified by assessing clients' needs, planning and organizing to meet those needs, directing and leading to achieve results, and controlling and evaluating the progress to ensure that goals are met. 5. Nurse collaborator. They work together with others toward a common goal or purposes. CHN work in government or private firms in collaboration with other nurses, physicians, teachers, health educators, social workers, physiotherapists, nutritionists, occupational therapists, psychologists, epidemiologists, etc. 6. Nurse researcher active questions relating to current knowledge and practice and finding an answer through research will contribute to the existing knowledge of community health nursing.